And I think we can get started now. What do you guys think?
Sure, your call.
I agree.
Works for me.
Okay. Hi, everyone. My name is Rebecca Dangor, and I'm a co-chair of the Health, Seniors, and Social Services Committee. And this is the July meeting, a joint meeting between our committee and Environment and Sanitation. And I just want to mention all the other co-hosts here. Barbara Rudder and Lori Borres are co-chairs of Health, Seniors, and Social Services. And then we have Kaz and Russell, who are co-chairs of Environment and Sanitation. And I would also like to thank Alita, Sarah, and May, who have also worked really hard to help us put this together. Right. So the first part of this meeting is going to discuss a bill, Bill A-10-500A, which evaluates the confidentiality issues when it comes to contact tracing. We all know that successful contact tracing is essential to our fight against COVID-19. But the problem is it only works if everyone participates. And it's very hard to ask someone who has little faith in our government right now that this information won't be shared with ICE and with other law enforcement agencies, or if the individual cares deeply about privacy. So with that, I would like to turn it over to Assemblymember Godfrey to discuss the bill. Thank you.
Well, thank you very much. I don't know if I need to do a quick explanation of what contact tracing is for everyone. Essentially, it's got a long history coming from dealing with various communicable diseases, particularly what used to be called venereal diseases. And public health people would talk to the person who was diagnosed with syphilis or something else and ask them, who else have you had contact with? And then they would go out and talk to those people and say, first of all, you should know that you may have been exposed to syphilis. And second of all, who have you had contact with? Years ago in the mid-late 1980s, when we were working to encourage people to get tested for whether they had HIV. And that was a time when getting people to do that was very difficult because people were concerned that if people heard that someone had AIDS or HIV, there would be social stigma, they'd be discriminated against, et cetera, et cetera. And what was quickly realized was that in order to get people to be willing to come forward to be tested, we had to guarantee them as complete confidentiality as possible. And I remember thinking at the time, why do we need a law for this? Don't we have confidentiality of health information that would protect everyone? And it turns out that, guess what? No, we don't. Almost all of certainly at that point, almost all the rules of confidentiality about healthcare information were custom and the hallowed practices of the medical profession, what have you. When we went to try to see where in the law is this written down, it wasn't. And so we set about to draft confidentiality legislation specifically for HIV and AIDS. And it got to be very elaborate and very complicated because we wanted to be able to, if you're going to test people, you want to provide that information to their doctors and healthcare providers and whatnot. Took months to get this drafted. But once we got it enacted, A, it was very successful, and B, it became a model for legislation all across the country. Well, when COVID-19 contact tracing became something that we wanted to do on a large scale, I and others involved with privacy issues and the like said, we better do something to guarantee confidentiality of this information, or else people aren't going to give up their information to city health authorities. And again, I said to myself, wait a minute, isn't there confidentiality legislation to protect information, particularly with communicable diseases, as this is? And again, I went to look for it and discovered, guess what? It isn't there. And so we very quickly, working with the New York Civil Liberties Union and several other advocacy groups, privacy organizations, pulled together a bill that basically says a couple of things. One is it says nobody who is in law enforcement or immigration enforcement can be engaged in contact tracing, and no contact tracing information can be given to law enforcement or to immigration. And beyond that, we also said contact tracing information can only be given to a government affiliated contact tracing agency like the Department of Health, and may only be used for purposes of contact tracing. We put in an opportunity for the individual to waive that confidentiality, including for what the bill calls support. If you're dealing with the city contact tracing people, apparently they will do things like offer to help find a hotel room for you or arrange food delivery, et cetera, et cetera. And so we wanted to enable that information to be used for that purpose, but we said it would have to be with the consent of the person whose information you're dealing with. And that's what the bill does. It's, it's not all that complicated. Because we wanted to get a lot of people's opinions on it, we've been making amendments, drafting amendments to it. I think we're about ready to nail it all down. The bill has, I think 50 or 60 co-sponsors. It's supported by the New York Civil Liberties Union, a lot of legal services groups, a lot of immigration groups, various health organizations. And I am hoping that when the legislature comes back into session, which I expect will be at least briefly in the next, 2 or 3 weeks, that this will be part of the agenda. So that's the story.
Thank you. And I don't know if you could maybe briefly also explain that the bill mandates that all information has to be expunged or de-identified every 30 days.
Yes. We didn't want to have the information, just lying around. Bad things happen when information is left lying around. And so the bill says that it must be either expunged, erased, eliminated within 30 days, or it can be de-identified. And there's a fairly elaborate definition of that. It means making it so that no one can look at that information and say, oh, that's my friend Bob they're talking about. Now, people have been de-identifying information, particularly in the health area, for a long time with computers and whatnot. De-identifying has become a more involved process because apparently, computers and artificial intelligence and whatnot can figure out who somebody is from information that maybe 10 years ago you and I would have thought was completely scrubbed of any identifying information. But with so much of the knowledge about us being around, we put in some extra language that basically says nobody should be able to use any technology to trace back who this is talking about. If a piece of information says this person who is 6 feet tall was in Macy's shoe department last week on Thursday, you may think that de-identifies them. But if you've got all the information that that Macy's and that Facebook and all those other people have about you, they probably know that you're 6 feet tall and you were in Macy's shoe department last Tuesday buying brown shoes and that your size is 8.5. So scrubbing information about you takes more than it did maybe 10 years ago. So we put a lot of that into the bill. And so the bill says that after 30 days, it has to be either completely erased or de-identified, although it allows an extra 15 days if the contact tracing entity is in fact actively using that information for the purposes of contact tracing. So if it takes a little longer, they can get a little longer. But generally, there comes a point where it's got to be wiped out or wiped very clean.
Yeah, I think we would like to take some questions. If there's any members of the public who have any questions for the assembly member, just raise your hand in the participants box. But I do see we have 2 board members with questions. So Barbara.
Hi, Dick. Thank you. That was a wonderful explanation. I will say I had something that was communicable. I had something that questioned whether I had some sort of genes could be looked into. And for years, my doctor said, don't bother doing anything because it is not private. And in my case, I wasn't as worried about law enforcement, I'm very proud to say, but insurance companies, my jobs, my children's jobs and contacts and so on. How is this protecting now? And my second question that I want to ask is, and what if somebody does do something? What if somebody says, did you hear that Joe Smith was really sick? What consequences is there?
Yeah. Well, the confidentiality of genetic information, I'm not up specifically on what current New York law is on that. My recollection is that a few years ago, we passed genetic information confidentiality legislation, which at least applies in New York.
Yes, I was told yes, and I did go through the genetic testing, but it took me years until I did it.
Yeah, and so your other question, what if somebody breaks the law and, over dinner says, oh, you ought to wait till I tell you who I found out has COVID-19. You saw his movie last week. And the answer is that would be a violation of the public health law. And because this bill would be in the public health law, and any intentional violation of the public health law is a misdemeanor. So obviously, like with any crime, somebody's got to be caught, they've got to be convicted, but it would be a criminal act.
Yeah, I was thinking that somehow insurance company found and suddenly denied my insurance or raised my rate or something like that.
Yeah.
Which was a worry that I had. Yeah.
And by the way, one other, I don't know if anyone will ask this question. It occurred to me the instant I started drafting the bill that to get this done quickly now, we limited it to COVID-19. But it really ought to apply to contact tracing or any communicable diseases.
Right.
And my plan is that once the bill is signed into law, I'm going to introduce a bill to amend it to make it apply to any communicable disease.
Yeah, that's great.
Don't tell the governor that. Of course,
Okay,
my
so
amendment won't become law unless he signs it. But.
Right.
The next question is from Brian, our new board member.
Hey, I definitely appreciate the explanation in the beginning, and I'm of course supportive of any type of contact tracing measures. I guess my thing I always go back to is just in timing, right? So the diseases that you talked about initially obviously have a longer incubation period and lifespan than COVID-19. Mm-hmm. So given, when somebody shows symptoms to COVID, to when they get tested, to when they get results, to when they actually meet with the contact tracer, I mean, you're talking about weeks have passed, since they, hopefully had the disease in most cases. So how do you kind of foresee, this this being successful given, the lifespan and incubation period of COVID?
Yeah, it's not a magic wand. I mean, until there's a really very effective cure or a very effective vaccine, we don't have a magic wand. But what it will enable you to do is certainly reach out to a lot of fairly fresh contacts so that they can quickly modify their behavior, quickly get tested, and it will also help 1 or 2 or 3 steps down the line. You go from the principal individual to one level of contacts. You then talk to those contacts, find out who they've been in contact with. And so the earliest people in the chain may be people where it's too late to make a whole lot of difference in the progress of their disease, but it will enable you to hopefully catch the next ring of people, and also help the contacts who you reach at least modify their behavior, so that if they weren't wearing a mask because, why do I need to wear a mask? You'll have a better way of explaining to them just why they really need to wear a mask. So it will do good. It won't solve the problem. It'll help contain it.
Yeah, and I think, for sure. And certainly knowing, where people have been, who they've come in contact with, I mean, it's all going to lead to, hopefully, God willing, some type of herd immunity if we can get there before we get a vaccine, who knows? So.
Yeah.
Okay, so the next question from Kaz.
Yeah, I guess you took away one of my questions. Is the bill general or specific to COVID-19? If you make it general, then really you don't have to do anything next time. It's already there. So that eliminated that question. Now, I'm in contact with somebody from Massachusetts. They go back, they test positive. Massachusetts calls me. Now, this bill is only for New York. Is there relevant cross-state privacy, or once it leaves New York, it's open season?
At this point, the bill would allow giving the information to contact tracers from Massachusetts,
Right.
but it doesn't on its own. It doesn't restrict what Massachusetts can do.
Correct.
The way to try to do that next step, which New York, I think, has done, voluntarily through contractual agreements with other states, is to say, we'll give you our information, and you'll give us your information, but only on condition that we both are committed to not dispersing it, in violation of confidentiality. And states regard that kind of cross arrangement as being enough in their interest that it has been used a lot.
But until it's federally mandated, it becomes a federal law. There could be one state that really bucks the system, and it's a free-for-all. So until then, now the 30 days before the data is expunged, is that too soon, or should it be 60 days? Because by the time I test, then it takes several days for you to contact somebody. Then they're not going to answer. So by the time you contact somebody, it could be a week or week and a half. Then they've got to quarantine for 14 days. So by that time, is the 30 days too soon?
I don't think so. Remember, the clock begins to run when the information comes into the hands of the contact tracing agency.
Okay.
So that postpones when the clock begins running. We authorize them to keep it an extra 15 days if they're actually using it for contact tracing, so that it isn't just sitting around.
Okay.
And certainly if it turns out that that information is generally needed longer than that, the bill is not going to be engraved in stone. And frankly, if between now and when it's enacted, if the state health department wakes up and pays attention to the bill and says, oh my God, 30 days isn't enough, it's got to be 60 or we're going to have the governor veto the bill, we'd probably amend it to 60.
Mm-hmm. Okay, thank you.
Okay, next, our board chair, Alita.
Sorry, thanks, Rebecca. I had a couple of quick questions. One is, did I miss this? And if I did, I apologize. Does it apply to providing information to insurance companies too?
Question, yes.
Yeah, there would be no providing of information to insurance companies. I mean, unless the person who is the subject of the information were to consent. I don't know why they would, but it is very strict that the information can only be used for contact tracing, which is defined in the bill, or it can be used broader than that with the consent of the person about whom, who the information is about. So if they want to give it to your insurance company, if they want to give it to your landlord, if they want to give it to your Uncle Harry, they cannot do that.
And then just to piggyback on what Kaz said, I read that within the last couple of weeks, they found that there are super spreaders, that a small percentage of the population seems to be responsible for spreading a large amount of the virus. So with 30 days or even the 60 days or 45 days with the extra 15, account for that, because wouldn't that be important information to figure out that person A has spread to 5 people within 10 days and then another 10 people within 20 days? So that and I don't know enough about how it works with spreading it, but is there any kind of accommodation for that? And then my last quick question is, who is opposing? Is there anyone opposing this bill?
Well, in terms of finding people who are, who are super spreaders, I mean, what you really I think what you really need to find out is which people who are infected are having contact with a whole lot of people. If somebody is more highly contagious than others, a higher percentage of the person's contacts might have become infected. But how many people they contact in a given period may not be any different from anybody else. And again, if the information is being actively used for contact tracing, you can get an extension of the time. And then when you're reaching out to the contacts, essentially, they then become the starting point of a new round of contact tracing, and you've got, a new 30-day clock running. On the question of who's opposed to it, so far, we haven't found anybody opposed to it. Now, it is often the case with legislation that people who really hate your bill, until they see it really moving, they may not surface. The one negative voice we've heard is from the city health department, not health department, the City Health and Hospitals Corporation. Because as you may have read, the mayor, for reasons we don't need to get into, chose to put the Health and Hospitals Corporation sort of in the driver's seat of the contact tracing process in New York City, rather than the health department. Not a good idea in my book, but that's what the mayor's doing. And when Health and Hospitals looked at it, they thought that some of the language in the bill gave the health department too much authority, and they thought it would interfere with their ability to do their job and, you know, to run the program. And I said to them, well, first of all, I don't think so. I don't think the wording does what you were thinking it does. And second of all, if this bill puts some authority in the hands of the health department, which has been doing contact tracing since the 1800s, frankly, I'm happy about that. But so far, the Health and Hospitals Corporation's comments have been the only negative comments I've heard. Now, of course, that doesn't mean that tomorrow the health department might wake up and say, oh my God, this is the most god-awful bill in creation.
Thank you.
Great. Next, we have Russell Squire.
Thanks. And thank you for coming, Assemblyman. So I have two questions. The first one, and I understand it's difficult to estimate, and you just got into some of the reasons why, but I was wondering what the sort of expected timing is for the bill. I mean, I understand that it's, you know, nothing is certain and it can be difficult to predict these kinds of things, but,
yeah.
You know, given that contact tracing is already going on and the sooner we can get these protections into place,
right,
the better. You know, what your guess is there, or what your sort of best estimate is.
Yeah, well, the legislature has been, I mean, since the beginning of April, we have convened 2 or 3 times. We have convened, you know, like for a day or 2 at a time. We've come together remotely, like we're doing right now, which is an interesting process. I expect that we will be next in session towards the last couple of weeks of July. I mean, that's not definite, but that's what people are expecting. And so if the bill is keeps moving forward as it has been, I am hopeful that we will be voting on it in the Assembly and Senate sometime in the latter part of July. Now, that doesn't guarantee the governor signs it. It doesn't tell us when he will sign it. But we're going to do our best to get him to get on board with it.
Thank you. My other question is one that I am planning to ask Carrie, but I'm kind of curious to get your views on it as well. So I think the bill is pretty clear about the limitations on the sharing of the contact tracing information. It's very clear that it can't be shared with law enforcement and so on. My question, though, is what can be done, or is there any possibility for federal law enforcement to get this kind of data, notwithstanding the bill, because, you know, through a federal subpoena or something along those lines? I mean, on the one hand, you know, this would be data that's collected pursuant to sort of state and local authorities. So hopefully they would have the last word on how it gets used, but I just am wondering what your thoughts are on that.
Yeah,
question.
Well, as I often say, they do have bigger guns than we do, legal and otherwise. Yeah, there would be a court fight, whether a state or federal court would tell a federal agency, sorry, you don't win here. I don't know. For the federal government, I don't think it would be an open and shut case. You know, there are federal laws about how the immigration people go about their business. And to a certain extent, you can make a case that the states have authority under the 9th or 10th Amendment to have primacy in areas relating to public health. And if I was Tish James, I would make, I think, a fairly strong case that New York has this ability, if necessary, to protect public health, to keep it out of federal hands.
Thank
But
you.
we may end up having to call up my high school classmate Jerry Nadler and get him to do something where in his workplace.
Yeah. All right. Thank you.
Thank you.
I didn't mean
have a
to leave
question,
out
but
Carolyn Maloney, by the way, except she didn't go to high school.
before I ask my question, I just want to remind everyone that it's *9 to raise your hand on the phone, and that all of the chats you're sending to Will are part of the public record, and only questions raised by raising your hand will be acknowledged. And my question is, currently our participation numbers for contact tracing are still too low, in my opinion, for it to do all of the success that we need it to. And so my question is, I mean, I'm assuming that if this bill is passed, becomes law, that hopefully those rates will increase. But have you thought of any other ways besides just through protecting the confidentiality to help improve our numbers?
The confidentiality thing is to me is the main missing piece. I think part of what needs to be done is, as with the census, public announcements, trying to be persuasive with, having the health commissioner and rock stars and whatnot go on TV, and try to just, encourage people to come forward and be cooperative. The city and state will need to make sure they keep hiring enough people and training them well. I think in terms of legislation, though, the confidentiality protection is the main thing within my, work area.
Okay, thank you. And we have another question from Cause.
Yeah, this just been thinking, privacy and protected information. You call me, I give you information. You enter it online and it goes somewhere. Is that protected digitally?
Yeah, well, I think it depends on what system you're using it in. I think a lot of people have learned that a lot of things that we thought were pretty secure can get hacked into, including our bank records and a whole lot of other stuff. I think the history of protecting the security of health department information has been pretty good. There's a lot of information that they hold that, if it got out, could be pretty mischievous. And it used to be that every so often you'd hear a story about some hospital that had put cartons and cartons of what they thought were old records out with the trash, and people were rummaging through it. I don't think I've heard stories like that in a long time. Partly because hospital records are now almost all electronic. But the health department's confidentiality track record is pretty darn complete.
But could something be written in the bill that all the information collected, wherever it goes, is protected? Or is that too far? Too wide?
Well, the bill says that, I don't think that would be done in this bill. It would be, and I think has been done in health department regulations, in their practices. There may be statutes that deal with that. I don't think this is the place to try to spell all of that out, but I think I can say with a lot of confidence that there are in place very solid safeguards that we can rely on. And if you think about it, you know, the health department has records of, you know, all sorts of adoption information. They have records of who's had an abortion. They have all kinds of health records about, I mean, if you've ever been to a hospital, the New York State Health Department knows exactly where and when that was and what the diagnosis and all of that stuff. And that information doesn't get out. And it could do a lot of damage if it did. The HIV data and all of that all has a very successful record of being kept confidential.
So that means I can sleep soundly tonight?
Well, you would know that better than I would. I don't think you have to stay awake worrying about whether your health department information is going to leak.
Thank you.
Okay.
Okay, I don't see any more questions. So I just want to say thank you so much.
You're very welcome. Thanks for being interested in this.
For coming, and we're hoping that it'll be passed soon, and we will help advocate and inform people of any changes that happen.
Well, great. Thank you.
Okay.
Okay.
Thank you.
Bye-bye.
Okay, so for to move to the next part of our meeting, we're lucky to have Carrie DeSalle, who's a staff attorney at the Knight First Amendment Institute at Columbia University. And she's gonna further elaborate on all of the kind of security and privacy concerns related to contact tracing. So with that, I'd like to turn it over to Carrie.
Hi, everyone. Thanks so much for inviting me to join this discussion. So I did catch the previous presentation in this series about New York City's Test and Trace program, and it was incredibly illuminating about the kind of information that the program is collecting through the contact tracing efforts. And, you know, this information includes a lot of sensitive personal information, as the presenters readily acknowledged. It includes information like names and birth dates and demographic details, including race and ethnicity, sexual orientation and gender identity, I understand. Also, obviously, information about symptoms that people may have been experiencing, and then the people that they've come into contact with, including household members, intimate partners, folks who come and work in their homes, and then just, you know, anyone they might have come within 6 feet of and spent 10 minutes or more with. And disclosure of this kind of information, you know, certainly beyond the health authorities, would raise very significant privacy concerns. And so I'm very encouraged to see the bill that was just being discussed, and the privacy protections and confidentiality assurances that it seeks to put into place. And was also encouraged to hear that the Test and Trace program is particularly committed to protecting privacy and maintaining confidentiality in the way that it collects the information and stores it. So I guess I'd just like to highlight a few of the key privacy kind of protections that could be put into place to really create community trust in these contact tracing programs, which public health experts seem universally to agree are completely necessary if we're going to start reopening society in a healthy and safe way going forward. So first, you know, these programs should be voluntary, and it seems as though New York City's is, that no one's being compelled to share information when they're called, and it really relies on the kind of active participation of the public, and that depends on trust in the system. And, you know, beyond that, when it comes to sharing of information collected through these contact tracing programs, you know, we would emphasize that voluntary participation means really informed, consent-based participation. And so that's something else that we're encouraged to see kind of reflected in the Assembly bill. nor is a contact tracing program voluntary if it's a condition on one's ability to go to work or go to the grocery store, or these other kinds of limitations that we've seen put in place in other countries. But again, it seems clear that that's not exactly what's going on in this context. So second, any contact tracing program should try as much as possible to maintain the anonymity of the individuals who are speaking to contact tracers. And, again, I understand that New York's test and trace program really does try to maintain anonymity. It's not going to reveal the identity of somebody who has tested positive for COVID-19 or displayed symptoms after coming into contact with someone who's been exposed to that person's contacts when they reach out. They'll just inform contacts that they may have been exposed within the relevant time period. And so that's a great starting point for maintaining anonymity of the folks who are sharing their health information with a contact tracing program. Third, these contact tracing programs really should minimize the data collected to the kind of data that's absolutely necessary and most relevant for public health purposes. And I think that the information that I described as being collected as part of New York's program fits the bill, and it all seems directly relevant to the public health purposes that are motivating this contact tracing effort, this massive, very impressive contact tracing effort underway in New York City. But importantly, the fact that we're facing a current health crisis should not be used as an opportunity to collect information and stockpile it in government databases for use for unknown purposes down the line. The core focus of these programs should be on confronting the current COVID-19 crisis. And as a result, the data that's being collected should be limited, as I mentioned, to the data that's most relevant to that purpose. And relatedly, it should be erased after it has served that purpose. And we were just talking about this with the Assembly bill. But the kind of detailed contact information that's being collected through these programs may be largely irrelevant for public health purposes, far beyond the incubation period of COVID-19, which I understand based on current research is 2 weeks. That may be subject to change, and it may be that contact tracing programs, as we were discussing earlier, require the detailed contact information for a longer period just to be able to reach out to as many people as possible. But there should be some endpoint to the retention of the data that's being collected as part of these programs. And then ideally that information should be kind of automatically deleted after the end of that period. Or at least, and I'll mention this a little bit later, but de-identified, and as was mentioned earlier, de-identification is a tricky process, but there's some good definitions that work in the Assembly bill, and so hopefully those can be carried through. Fourth, the program has to impose strict limitations on the sharing of information that is collected through contact tracing. This goes to the core of community trust in the program and people's willingness to participate at the outset. But again, the information should be shared only insofar as is necessary to actually achieve the purposes of contact tracing and address the current COVID-19 crisis. Any program should ensure that information will not be made available to law enforcement or other third parties for any use beyond contact tracing, whether it's immigration enforcement or marketing for that matter. The information should really be kept safe within the public health authority system to the fullest extent possible. And fifth, I think this is something that maybe Kaz raised a little bit earlier, but the program systems and databases should be tested by data security experts and kind of examined to make sure that they're as secure as possible to prevent inadvertent disclosure or hacking. And it seems as though there may be pre-existing health department regulations or other laws in place that assure that health information is being maintained in a secure environment. But that's one thing just not to lose sight of when we're talking about more intentional disclosures of contact information. There is always the risk of unintentional disclosure or kind of malicious hacking. So I'll just note, in addition to all of those key privacy concerns, that I do think that New York is avoiding a real concern that's arising in the context of discussions about digital contact tracing programs, by focusing its effort on human contact tracing programs, on door-to-door kind of telephone-based individuals calling other individuals and asking for their information. And that concern relates to the digital divide that exists in New York City and other places in the United States and all around the world. The fact that a lot of people may not have an up-to-date smartphone or reliable data plan. And so any contact tracing tool that relies on an app that you would install on your phone might leave out large portions of the population, and potentially portions of the population that are particularly hard hit by COVID-19. So I do think this rollout of a very significant human contact tracing effort in New York City is laudable for that reason as well. Beyond that, I'll just touch on some of the features of the Assembly bill that we were just discussing that seem quite promising to me. In particular, I think the bill does a good job of trying to address the disclosure of contact tracing information, and it seems to be the key purpose of the bill. In ensuring confidentiality, the bill provides that contact tracing information will be kept confidential and not disclosed to others, except as necessary for contact tracing purposes specifically. So this goes back to the purpose limitation that I mentioned before. Again, we're only collecting this information because we're in this current health crisis, and it's needed for that purpose specifically. And once we start letting it bleed out into other purposes, you run the risk of A, people losing faith in the system, but B, just creating too much of an intrusion into personal privacy that's not justified by the current crisis. And the bill, as we were discussing, really limits the retention of the information to this 30-day period, potentially 45-day period. And to me, at first blush, that seems like a pretty reasonable retention period for this information. It's important for people to quarantine. As I understand it, it's important for people to quarantine within 14 days of having been exposed to somebody. If you're not contacted for another 2 weeks, it may be that the cat's a little bit out of the bag at that point, but regardless, the contact tracing program will only be as effective as it is kind of speedy. And so that goes more to the effectiveness of the program at the outset, I think, than the need to retain information for much longer periods of time. I'll just kind of emphasize what the Assembly member was saying, is just in the sense that de-identification is quite difficult these days. And I think the definition in the Assembly bill is fairly robust. It's a good, robust protection, and it remains to be seen whether or not somebody can put into place the kind of de-identification measures that are described there. But the definition itself, to me, seems quite good. It's just worth noting that de-identification can be difficult, and a savvy technologist with access to enough other data often can readily re-identify somebody. But the language of the bill, as I said, seems like a good initial protection on that score. And then again, just going back to the purpose limitations, I think it's good to see that the bill prevents the disclosure even of aggregate de-identified information for purposes other than public health purposes. It really limits the collection and disclosure of that information, again, to public health purposes. And it seems like the core of this bill is preventing the sharing of this information, particularly with law enforcement and immigration authorities, and in the context of administrative and judicial processes. And especially at the state level, this is a really important and necessary protection in my view. I'm happy to touch on Russell's question a little bit, unless we want to save that for him to ask again. But I think this is an important protection, even if federal authorities may be able to override it with subpoenas and court orders in certain cases. So under the Constitution Supremacy Clause, a valid exercise of federal authority can preempt or override even state law protections that are as clear and important, in my view, as this one. A subpoena that's issued under clear federal authority it may be able to overcome the obstacles presented in this bill. But that said, the bill itself can really bolster an individual's expectation of privacy in this particular information. And that might give rise to a fairly strong Fourth Amendment claim against, information being shared from the contact tracing program with federal authorities to basically say, you need to get a warrant at the very least to be able to demand this kind of information, because it touches on information that I have a very clear, strong privacy interest in. And so the government's held to a heavier burden to justify demanding disclosure of that information. So there are, I think it certainly would end up in court if that conflict arose. And I think that there are arguments to be made against disclosure of contact tracing information to federal authorities. But at the outset, even just to issue a subpoena, the federal authorities would have to issue a reasonably specific subpoena. They wouldn't be able to go on a big fishing expedition for information being collected through this program. And I think the language just clearly prohibiting the sharing of this information from the beginning will provide a good a foothold for other arguments that people can make against the sharing of this information. But I do think ultimately we need Congress to enact stronger protections against the disclosure of contact tracing information to any authorities other than public health authorities, and for any purposes other than public health purposes.
Thank you.
Yeah, sorry if that's not the answer folks were looking for, but I think that's probably the case.
Yeah, I was going to ask.
I think we can.
Thanks for doing that. Go ahead. Sorry, Rebecca.
Oh, no. I was going to say that too. I think maybe re-ask, although it's kind of answered, but.
Yeah, I think that answered the question. I mean, it was yeah, you answered it. I mean, it sounds like it's a live legal issue, and there's going to be good arguments to be made on both sides. And it's certainly not a sure thing that this provides the protection, although, hopefully it would. But that doesn't mean that we don't also need good, strong state level protection. So I think that's the answer to the question.
Mm-hmm. And the protection, like I said, does go a long way in state court and against state law enforcement and local law enforcement. Like, there are a lot of very worthy protections that are not subject to the same kind of override by federal authorities.
Great. Barbara, I see has her hand up.
Yes, I have a comment, but I do have a question or an observation. When we talk about scrubbing the data, I wonder if we want to do that. I should imagine that some of the information we get can be used for research. For instance, Alita's comment about super spreaders. Why is it I've been exposed and I didn't get sick, and yet somebody else spread it to 14 people? Isn't this information that possibly could be used where maybe my name and my age and other things, or maybe not my age, maybe an age range would be scrubbed? But don't you think that for further research, it would be important to know certain things so we can analyze more, so we can learn more about this disease that could possibly lead us to the next one that would probably not be 100 years from now?
Yeah, I've actually, some other folks at Columbia University have been developing a different kind of COVID tracking tool that it really is a survey-based tool, and they're using that to try to predict new hotspots in the epidemic and pandemic, and to direct resources, public health resources appropriately. And so there are related purposes, for which this data makes a lot of sense to be used in certain ways. I think that it may be, that said, that de-identified and aggregated information, which really does kind of protect individual privacy much more so than identifying information, certainly could serve those same purposes. And my reading of the bill allows for that. So if you have this de-identified aggregate set of data, that can be directed to other public health purposes, certainly ones related to the COVID-19 pandemic, but potentially, even at one further remove. I'm not sure exactly how the bill is envisioned with that particular provision.
Have you ever been part of a study? I'm not Barbara Rudder, I'm number 583, but I may have an age range, I may have a diagnosis, what is it? So I guess if anybody is really smart, they can probably figure out who I am. But I think that there's ways of doing it, but this can be very important information. You know, why did people in nursing homes get sick? Why is it the Black and brown population that's getting it? And they're finding more and more now by getting this information and working with it. And it can be very important for the future, as long as privacy isn't invaded. So there's the gray line along with it.
Yeah. Well, I'll also note the consent provision in the bill. So if, you know, within this time frame where you're identifying information is being maintained by the public health authorities, researchers say this is a person that we'd like to follow up with and ask a lot more questions, then you can be provided with a waiver form and be asked to participate and volunteer to participate in that study, as long as you understand fully what you're agreeing to and, you know, sign in writing that you're waiving the confidentiality provisions of this bill. That's another way to get more information and potentially a lot more information about people who have tested positive or come into contact with COVID-19.
And
that still respects
follow-ups. We're finding that people that were sick may have neurological problems, may have heart problems, and things that can follow up. So I see that some of that information could be very interesting. However, data is dangerous. Understand the privacy. Thank you. This was wonderful. Thank you very much. It was very interesting. And
my pleasure.
Cause, I saw you had your hand up earlier, but it's lowered now. I don't know if you had a question.
No, it's fine. No, I guess my question was, if the federal wants information, they must have a specific reason for wanting that person's information. So, I mean, they're not going to go after everybody. So are we putting too much dependency on privacy from the federal? And by the time the data gets expunged by the, 30 days, the courts will have the federal tied up for 6 months. By the time they give them permission, by that time the data's scrubbed. So what are they going to get?
Yeah, I think the first point is really important. I mean, even if the health authorities do receive a subpoena from federal authorities, it has to be reasonably specific to begin with. So they have to kind of know what they're looking for. And that is a protection on its own. I then, you know, it's possible that if you're subject to a subpoena, you would have to preserve that information while you're testing it out in court. And that arises lots of times in the context of court cases where there are things called litigation holds and you're told not to delete things that might be part of the case going forward. So I think in general, the 30-day deletion requirement, expungement requirement is very important, because if you don't receive a subpoena within that time frame, then the information is gone to begin with. And so that provides a very strong protection against the sharing of this information going forward. There's just this narrow window where it might be an issue, but again, as you described it, I think it is a fairly narrow window.
So I can't hit the erase button rather than the save button. You might get in trouble with the courts and the federal authorities if you delete the data that's specifically being sought under a subpoena before the court has had a chance to weigh in. But putting that aside, you know, there are some good protections here. Thank you.
Sure.
And I have a question. Are there any measures that you feel this bill should address that it's not currently doing so, especially as how we're doing contact tracing might change?
That's a great question. I mean, I was quite impressed with it on first reading it, I'll be honest. And the one kind of omission that jumped out to me is just the data security provision. And I know the Assembly member addressed this and said that there are probably other laws or regulations in place that require health information to be maintained in a secure fashion. But I just think that having some outside data experts or some kind of security audit is probably a good idea, just to provide added assurance that this information specifically won't be exposed to hackers, or, you know, just sent in an email, like a password shared by mistake or something along those lines. so that's a kind of a side concern from the main confidentiality concerns that are addressed in this bill. And like I said, de-identification is tricky. And so I think the definition and the de-identification requirement in this bill looks quite good on paper. It would just be worth involving technologists to flesh out what those requirements really mean on the ground. I do not have a technology specific background, unfortunately, but there are lots of experts who I'm sure would be willing to help out with that.
Great. Oh, I see we have another question from Peggy Price.
Hi, yeah, thanks very much. So I've been reading that some people who have become victims of COVID-19 are refusing to disclose the names of people they've recently come in contact with. Is there anything about the bill or any other way the state is addressing this issue of what to do about those who refuse to divulge the names of people they've recently come in contact with?
So not from what I see, to be honest, and it may be that other people have more information, but I do think that one of the strong features of this program and most of the contact tracing programs they've seen in general are that they are voluntary. And that provides a good protection against people who have particular concerns about sharing certain sets of information. But it also means that that community trust is the most important element here, because that's what's going to encourage people to share their information. And so putting these other confidentiality protections into place, it's kind of crucial to establishing that trust. Shy of imposing some kind of a mandatory contact tracing requirement or information sharing requirement, there, I'm sure, are going to be holdouts, individuals who just believe and cling fast to their belief that they will never share this kind of personal information with government authorities. My hope and my sense, just based on my New York neighborhood and the communities around me, is that a lot of people are really kind of pitching in to stay safe and wear masks and do take other precautions that have been encouraged by the state to protect our broader community, and so that people will view this program in a similar light and kind of take to it with a civic mindedness. But there, I'm sure, are going to be some folks who just won't.
And we have another question from Barbara, who's already unmuted.
Am I unmuted?
Yep.
Yeah.
Yes, I'm unmuted. It may be too early, but I would like to place a resolution to say that we approve of this this bill, would like to go along, and possibly, and I would like whereas to say, and somebody who understands privacy, I don't know if you want to mention Carrie's name, has said that the bill, is good. Your wording would be much better than mine, but possibly to say we would like to add something about technology being, somebody, an expert, to make sure that the technology is as safe as possible. Did that make sense? But I would like basically a resolution to say that we approve the resolution and encourage the state, the Senate, and the Assembly to pass the bill.
Do we have a second? Is that Peggy? Are you raising your hand?
Yes.
As a second?
Yes.
Okay. Great. And I think we don't have to spend too long, but I would like to make sure that any board members who have a point they want to make sure is included in the resolution has an opportunity to do so. So if you have any comments, I would love it if you would just raise your hand. Russell?
So yeah, I think so. I agree that the Assembly bill, we should encourage that it get passed and signed by the governor. And then I think basically it sounds like there are sort of two issues that are beyond the scope of the Assembly bill that we probably also want to include in our resolution if we're only doing one resolution. And I think the two issues are, number one, the data privacy issue, and number two, the federal legislation issue. So I would say, you know, it would be good to have the resolution say we encourage, you know, similar federal legislation to the Assembly bill, you know, to also provide protections at the federal level. And then I think for, you know, data privacy, I think, you know, we want to say that, you know, that we want to make sure that any, you know, use of technology or even absent, I mean, it's an issue even absent the use of an app. It sounds like basically, you know, you have, we just want to make sure that however the data is stored, that, you know, the necessary or the highest level of data security protections are in place for people's information. And I guess to Barbara's point, I mean, maybe we should say that they should, I don't know if we want to specify, you know, who they should consult or something along those lines, but I definitely think we want to make the points that Carrie said on about, you know, ensuring that this stuff is maintained securely to, you know, and isn't going to get hacked or disclosed or anything like that.
You said it much better than I did, Russell. Thank you.
Sure.
Next, Alita.
Thanks, Rebecca. I don't know where the place for this is, and I don't know if you've looked at this enough, but given that someone, I think it was Carrie, had said that the analog people calling and having that personal touch is more effective for getting a higher percentage of people participating in the contact tracing, if that's something that you want to add about using people rather than apps. And I know that there's a whole world of questions and analysis required in thinking about apps, but if it's something that you just want to address or look at in some way based on her comment. Thank you.
Yeah. And I guess one, I'm wondering if we want to, if it's better to separate everything we're discussing into two resolutions or just one. If we really, because I do think it's very important to show how supportive we are of the bill. And so I don't know what everyone else wants to do, but I'm wondering if maybe we address the federal issue in a different piece of legislation. I think it is appropriate to raise the problems with data security in the bill and support, but I'm not sure what you guys think. So, Lori?
Yes, I agree with everything you just said, Rebecca. I think that it's important for us to come out in support of this bill. And if you want to do another bill dealing with the federal, you know, and the use of apps and you know, other things, fine. But I do think that we need to, you know, speed this along and support this bill. So I agree with everything you said.
Okay, great. I see Wilma, who's on the phone, has her hand up.
Hi, I'd like to ask a question about the privacy of if I go to get tested and the place where I got tested said that I'm positive, and after that, how can my information be protected if they're going to have to get in touch with anybody that I was in contact with? How's the information protected?
I think Carrie is still on. I
can take a stab. I think this depends on the mechanics of the New York City program. My understanding is that if you test positive, then you may be contacted by a contact tracer and then asked to provide information about the people you've come into contact with, so they can reach out then. But
okay, so
my understanding is you don't have to do that.
Okay, but in order for them to find out all the people that I'm in contact with, that's going to bring out all the information, my personal business, to contact those other 50 or 60 people. So all the information is out in the open. I'm not protected with any privacy at all.
Well, I think, you know, in the first instance, it's your choice to provide that contact information. And I hope I'm not mischaracterizing the New York City program, but that's the voluntary nature of this program. You know, you get to decide whether you provide those contacts to the contact tracer to reach out to. And then when they do, if you do decide to do that, when the contact tracer reaches out to your friends or family members or whoever you list, then they won't say that you were the person who tested positive or was exposed to COVID-19. They'll just tell those individuals, you may have been exposed, and so please get tested or please start self-quarantining or what have you. So there is kind of a second layer of privacy protection in the sense that your name will not be shared with your contacts through the program.
Okay.
Does that answer-
Okay, that's right.
Did that answer your question?
Yes, it does, but I still think that if I'm tested positive and that company gives it to my information to somebody else to contact me, that's when it gets not private.
Well, I think it would, if I can just jump in, I don't think it's the testing, whoever tested you and gets the positive result back wouldn't be the ones who share the information. They would just share, if you get tested at a, wherever, and they provide you with the information that you tested positive, for example, all they're doing is providing that information to you. And then it's up to you to get in touch with the contact tracing program for them to reach
Oh, I
out.
see now. Okay, that makes a difference.
That's not right?
No.
I think from what I read and saw that sometimes the contact tracer calls you and says, oh, you may have been in contact with somebody that tested positive. But, you may have already heard it from your doctor.
Right.
So your doctor knows, the doctor may contact you, or the doctor must contact the Department of Health, who then gets the contact tracers.
Right.
So the doctor would put the contact tracer in touch with you?
I'm sorry?
The doctor puts the contact tracer in touch with you after you test positive?
I'm not sure who the doctor contacts, but the doctor can contact you, or the contact tracer contacts you. Because from what I saw in that the video, that when the contact tracer calls and said, you may have already been told by your doctor, but you may have been, you tested positive. So the doctor knows and the contact tracer knows. You may know or you may not know, depending on how you've been in contact with your doctor. But I mean, if you go for a test, they normally...
Well, in other words, I could be walking around with them deciding on who's going to contact me when they're going to contact me. But it'd be a few days. I could be getting sicker and spreading the COVID all around.
They're not
I mean, I think your doctor has to tell you regardless. I mean, whether the doctor also tells the contact tracers, your doctor has to tell you the result of your test.
If I'm not getting tested by my doctor, wherever I'm getting tested, they give the information to the doctor, and the doctor gives it to me. And then it's up to me to do something about it. Is that how it goes?
No, they do tell you.
Oh my God!
Now, if you go wherever you go for a test, you give them information on your phone number, and they contact you. So you go to a clinic, a hospital, wherever you go for a test, they notify you.
Yeah, when I went I got an email, and I clicked on it, and it said you're negative.
Right.
If I was positive, whether it's the lab that sends it or the CityMD that sends it, somebody contacted the tracer. The tracer would call me. I could say, don't bother me, I'm not picking up the phone, and I'm certainly not telling you everybody I was with, or I could cooperate and tell them, talk to them and or give them the information who I was with. So that's the voluntary. But when you go to CityMD or your doctor, they know your information, and when they go to the lab knows whether you're positive or negative. I mean, there's a certain amount that people know. Dwayne Reed knows every time I've gotten a flu shot because I go to Dwayne Reed for it. It's not secret.
No, that's not what I'm talking about. I understand that part. What I don't understand is how is information protected under this legislation that they're trying to pass? How is it protected, more protected, and then just going to the lab, and then if you're positive, the tracer gets in touch with you, and then you go from there?
I think part that one piece of this legislation is it's really focusing on what happens as soon as a contact tracer finds out that you've tested positive and contacts you. So the main, one of the main takeaways is that this information, your information about, let's pretend you tested positive, it will only exist in this database for 30 days, or it will be de-identified.
No,
Okay.
I thought the bill stipulates the person being contacted that's been in contact with somebody that tested positive. If I go for a test and the test is positive, the personal information is already protected under the legal health law.
HIPAA.
Right.
No,
The 30 days refers to you being in contact with somebody that was positive. Your information is the one that is deleted or erased or expunged or whatever you want to call it after the 30 days, not the person that tested positive.
No, but and maybe Carrie, you could.
I'm just looking at the bill.
I understood it
go ahead.
To that it's also your associates that those connections will be expunged as well.
No, your information.
It's all of the. It's all of the information that you provide to the contact tracing program.
Correct.
That's what gets deleted.
But this,
Correct.
Let's say this
After
is
30 days.
another thing. Even
after 30 days.
Even if there's contact tracing, if I go to CityMD and take the test, or I go to Dr. X and take the test, the lab knows who I am. They know my name. They know I'm positive. They know my age, probably. You know what my. They know my information. They get back. So even if there's no contact tracing, there is some information that's there, and I have to assume that HIPAA is protecting that at this point.
Correct.
Nobody ever questioned
That's protected under existing law. Yeah.
Let's turn it to Carrie quickly, just so we can fully.
Yeah, I just wanted to say, I think, so my understanding is that the contact tracing information that the bill addresses and that has to be expunged or de-identified within 30 days includes both the information about the person who tests positive and their contacts information. And so it's everybody whose information was collected for the purpose of the contact tracing program, that information will be expunged or de-identified. So if you tested positive, your information too would be deleted or scrubbed after that 30-day.
No.
Period.
Not your medical information.
Sorry, not your medical information, but just the information retained by the health authorities as part of the contact tracing program.
Yes. Okay.
Yeah.
Yes, I agree.
Sorry, no, it's good that your doctor has your medical history and all of that stuff. For sure.
Well, maybe
thank you so much. I understand it now, and the 30 days makes a big difference. I didn't know about the 30 days because I came in late, but that's very good. That gives me encourage to let them know everybody that I feel was exposed to, and then their information will get expunged in 30 days. That's good.
Good.
Yeah, we think so too.
Great. And I would just like to offer a friendly amendment to Barbara's resolution, which is that we include a clause that mentions that we're in support of this remaining totally voluntary. Both
sure,
and mention that it's essential to gain public trust, and because I think they kind of go together.
Call the question. Should we?
I think let's call the question, and then I don't know if maybe Russell wants to introduce the second part, a separate resolution after.
Okay, so this one also includes the data privacy, though, right? It only cuts out the federal stuff.
Yeah,
I think we should have the data privacy as a separate one. This bill.
Only the bill.
Yeah, only the bill.
Supporting the bill.
Correct.
That's
Thank you.
Just a clean resolution on the bill.
Yes.
And then the other stuff can be okay.
Right.
Okay, so
unanimous.
We're gonna let's just get a second on the call to question.
Yeah, second.
Good.
Wilma. Okay, great. So if you want to vote no, yes, vote no or abstain or not vote for cause, raise your hand. Otherwise, we're going to assume that you are voting yes.
Sarah's voting
Sarah.
no.
She may have a comment. Sarah may just have a
Just
comment.
let her explain her vote.
Yeah.
Hi. I don't know if I need to not vote for cause or not, because I work for the Innocence Project, and the Innocence Project is supporting this bill in the Assembly. And it's not-
I don't think so.
No,
No, there's no financial gain
Yeah, the
to
whole thing
you.
is-
Yeah, no, you're okay.
not making
You're
it.
right.
All right. I just wanted to make sure that I disclosed that. And okay, then I vote yes.
Great.
Thank you.
Okay, so it looks like it's unanimous. And I wrote down all of the names of the board members for the future. Great, so let's discuss the second part.
So is the second one, is there just one like omnibus resolution for everything else that isn't the Assembly bill?
Right.
I mean, that's fine with me. I think that's a good way to do it. So I think that's how we should do it.
It should kind of be framed as a, what else needs to be addressed.
Yeah.
Russell, can you tell me again what, I mean, I understand the data, like having an independent authority be sure that, the data is kept or not kept, as the case may be. But what was the other part?
Federal.
Well, I guess that's well, I mean, maybe we should, I don't know if Carrie has a view on the need for like an independent or to me, it seems like the key is ensuring that the data is secure, and then ensuring that data privacy for the information that is collected, because it's health information, is be as secure as possible. I think that's the main thrust of it, and I think having an independent expert to do it might be an additional protection on top of that.
Well, don't you think that the bill as it stands, I was under the impression anyway that the bill as it stands does that.
Yeah, it's not so much from I mean, the bill doesn't address data privacy. So what I think the additional point is that, anytime you're dealing with public health information or individuals' health information, that's very, very sensitive, and it could be the kind of thing that bad actors would want to go after. And so it's particularly important when you're dealing with information like that to ensure the security of that data. And so I think that's, the need for the strictest and strongest data privacy for that type of information isn't specifically addressed in the bill. It's sort of theoretically, the state should be taking good care of its data generally, and hopefully would do that. But that would be the additional point, is that this information really needs to be protected from a data security perspective, as opposed to a just sort of, general confidentiality and whether it gets revealed perspective.
Well,
I think it's.
All right, go ahead. I was just going to say, I'm not a lawyer, and I did not read, very thoroughly the bill, but I am under the impression that is definitely what the Assemblyman is wanting to do about this. And so it feels to me like this is a double down. This is like, and we really mean it kind of thing. I'm not sure that it addresses anything that's different from what's already there. That's just my opinion. And as I said, I'm not a lawyer, but.
And Russell, I thought you wanted to address on the federal level also.
Yeah, I think Lori's question was just about the data privacy stuff.
Yeah, no, and yes, it was. It was. And I'm in support of encouraging federal legislation as well.
I think my understanding is this would be a resolution that's calling for an expert in the field to evaluate the database currently and ensure that it meets all of their security standards.
As an aside, if you are in a restaurant or any establishment dealing with credit cards, your system is audited every 6 months. That's what the credit card companies require. Do we need to put something of that any digital data going anywhere, wherever it's going must have an audit on their system for data security and data privacy.
I mean, that's more specific than I personally would be comfortable, just because I don't know enough about data security to specify how they do it. But I think, yeah, appointing an expert to basically sort of assess it and ensure that it's going to be handled correctly, I think, you know, kind of solves the
Basically what Carrie said, I have to leave. Can I vote yes, even if I leave? My hand is up for yes. I approve what you say.
Now, Alita's shaking her head.
Are you shaking it yes or no, Alita? I can't see.
Well,
It's not, but it's
let's
not.
unmute Alita, if that's okay.
I don't think you can do that, Barbara.
To attend. Can we?
I don't think you can do that, because I once asked Jim Klein if I could vote in absentia, and he said, no, you have to be present for the vote.
I heard it all. Okay, I'll be a few minutes late.
So why don't we just get a resolution that we encourage data privacy? And I mean, this isn't going to be tomorrow. It's not going to be next month. It may be 6, 12 months down the road.
I think we want the expert. I think we want to go
just because, sorry, we're all unmuted and Brian has his hand up. I just want to make sure we get him.
Thank you, Rebecca. I appreciate it. I'm not an attorney either, but I do work for a health insurance company, and I have to agree with Lori that I'm not sure outside of HIPAA or PHI disclosure that there's really anything else as far as data privacy or data security that we can possibly do. I mean, you know, everybody has, since, you know, the big Anthem breach about 5 or 6 years ago with, you know, data security getting, you know, leaked, Social Security numbers getting leaked. Everybody that I know out there has cyber liability coverage. So outside of just encouraging, any additional data privacy, I don't know that, you know, really doing a resolution just for more data security is really necessary, because
I think Carrie's still on, because this was an issue that she alerted us to. So I'm wondering if maybe you could.
Bye. I have to go.
Yeah, sure. I guess I would just, I guess I kind of like Russell's formulation, just the idea that, you can put all of the legal protections in place that you want to protect against disclosure of this information. But if you have insecure databases where the public health authorities are maintaining all of this information, it might not amount to much at the end of the day if they can be hacked, or if it's just either subject to leaks, by mistake or otherwise. And so I don't know at all what the background regulations are in New York with respect to this kind of information. And it may be that there are already very stringent requirements in place, and potentially even regular auditing of these systems, et cetera. But it does seem to me that with this information in particular, and again, going to the community trust point, it would be helpful to have some assurance that security experts, whether internal or external, just that there's some assurance that the data is being maintained in a secure system.
Yeah. Okay. And I think, by us asking for it, who knows, maybe they're already going to do it, but making a statement also means that we want a response. So if it's done, we want them to be very vocal about that, so people will feel more comfortable participating.
Okay.
Alita?
Thank you. Do you want to say something about the data that's been gathered retroactively, and that it's not just taking care of privacy for data that they are gathering subsequent to any act, but that it also applies and things should be expunged or wiped just immediately? I would guess that if it's been in place for a while before the act before the legislation is enacted, that its purpose would have been achieved. So there's no reason to keep it. Maybe that's too much in the weeds. I don't know. I just also think about what happens to what they already have, and to make sure that we're looking at that too. And maybe it's not necessary. I don't know. I am a lawyer, but I don't know a lot.
I'll just say that that makes sense to me to have a retroactivity, provision there that says that these protections apply to the data that's already been collected through the contact tracing programs.
Yeah, I agree with that as well. I guess my only wish was that we would have added that to our resolution in support of the legislation, but I think we can still address it here.
Rebecca, we can also address it at the full board meeting.
As an amendment.
Yeah, I think so. I mean, Valerie's a parliamentarian. I think you know a thing or two also, but we have an opportunity at full board. And there may be discussions with other points that get raised too that we just haven't thought of.
Yeah. Okay. So I think I would just like to fully clarify what is going to be included in the second resolution. And Russell, I don't know if you had any idea of the wording you want for the federal element.
I think the federal part could be very simple. I mean, I think it would just be we encourage the federal government to pass confidentiality protections or legislation providing confidentiality protections similar to what is in whatever the Assembly Bill 10500A.
So are you? Sorry, go ahead.
Sorry, go ahead, Lori.
No, I was asking do we now have two parts of the same resolution? Because I'm still very hesitant about the first part. So like what's the exact wording? What are we?
So I think, okay, so there's multiple parts and maybe it makes sense to split it up, but I think the parts for the second resolution, there's a part encouraging federal confidentiality protections similar to what the state has. And I guess we should also we should probably specify, ideally the federal legislation would protect not only federally collected information, but would also protect, information collected by state and local authorities. So we should probably specify that. But that's the federal part. And then the other part is the data security part. And the idea is that because this is health information that's particularly sensitive, we are encouraging the, implementation of the strongest possible data security protections for it, including, assessment and assurance by, data privacy experts that the system is secure and that it's, that they're operating an effective system, something along those lines, essentially. That's the data privacy part. And our idea was to combine all of the just Assembly Bill stuff into one bill, into one resolution, I should say.
Right, but I was very moved, I guess, by the Assembly's statement that that the health department, which is administering this thing, is in possession of AIDS cases and abortions and like all really, really sensitive stuff that hasn't gotten out, so it's a pretty secure system to begin with. Not that, in today's environment, there couldn't be somebody who could hack it. I mean, that's, but I don't know. I just get this weird feeling that we're kind of like saying, yeah, we support it, but it's not enough. We also want you to do this. And it feels to me like his resolution was enough. I don't know. You can try to convince me otherwise, but I just.
So, I think it's not meant to be a comment on the Assembly Bill. And I don't think it's meant to be a criticism of the Assembly Bill, and I don't think it needs to be phrased in any way that suggests that something is missing from the Assembly Bill. I mean, I think we're very strongly in favor of the Assembly Bill, and that's what our first resolution is in favor of. So I don't think it needs to be or should be interpreted as meaning that there's something wrong with the Assembly Bill or the Assembly Bill doesn't go far enough. It's really a separate point, and it's a point that so I think that's why it's being made separately. And again, in the absence of knowing precisely what the sort of general data security stuff is in the state. And certainly there's going to be protections and stuff for health related information. I think the idea is that, for this, that's going to be collected very widely. And again, to provide the assurances to people as much as possible, which is really the goal here, because we want people to feel secure enough to actually participate in the program, that there's really no harm to provide to suggesting the strongest possible data protections, and the hope that the state and any entity doing contact tracing would implement those and really ensure that the data, from a data security perspective, again, not from a sort of like confidentiality perspective of who you're allowed to share it with, but purely from the sense of just, you're going to have a database that has a lot of personal and very sensitive information in it. You really just want to make sure that that's not going to get hacked or otherwise compromised in some way.
Yeah, I guess I disagree that there's a lot of sensitive information. It does feel that this feels like paranoia to me. It really does. So,
but all the contact person has is a phone number and a name. There's no real personal or private information there. They don't have your social. They don't have your driver's license. Right. They've got absolutely nothing. They have your phone number and maybe a name. I'm not quite sure. That's
Sarah. I think let's just unmute Sarah, because I think she might have a response to this discussion. Sarah, are you unmuted?
Yeah, hi. So I think on the face of it, names and phone numbers may not appear to feel personal, but the way that they can be leveraged can be personal, and especially when we're when there's such a disparity in how different communities are policed, and data takes on different values, and can be leveraged in ways that can surveil a population, that that who you associate with can become an interest of law enforcement. And obviously, this bill is designed to alleviate some of those concerns, but just that the act of association can be something that becomes punitive. And so that's why there's some concern about even just names and phone numbers, because they've been attached to you and they're people that you're associated with.
Yeah, if I could jump in, I completely agree with Sarah on that point, that even if it's just names and numbers of people that you've been in contact with over the past week or what have you, if I went to a protest last weekend, that's a lot of sensitive information about my First Amendment protected activity. If I am going to religious services or other things, there is sensitive information that can come through the contact tracing information. And even the Supreme Court has recognized that this kind of information might justify Fourth Amendment protection because it can reveal these sensitive associations.
But wait a minute. When the contact person contacts me, they tell me you may have been in contact with someone that tested positive. They don't know where I've been. They don't know where I'm going. They don't know they know the person, but I don't. So,
but it's not about what you know, it is what they know.
Well, and it's also for the initial person where they say, okay, you've tested positive for COVID. We need to understand all of the people that you've been in contact with. So let's talk about your recent history. Where have you been? Who have you been talking to? Who have you spent time with? And then I'm not sure if the contact tracing program goes to this next level, but if you have been contacted and told that you've been exposed to COVID-19, it may be that the contact tracer then asks you about people that you've been in touch with recently.
No, they can't.
It doesn't?
They don't.
Okay. But even that first individual, I think, has a lot of sensitive private information that can be revealed through contact tracing.
But they don't ask, where have you been? All they know is that I tested positive. I could have been, somewhere out of state or somewhere in a bar or somewhere that I contacted it. when I tell them, oh, I was in contact with a leader or Sarah or somebody else, and I give them a phone number, they don't know where they've been in contact with. They have no idea where they've been. So, you know, I think we're putting too much emphasis on this future, that it's for the future. I think we should just, you know, leave it alone for now and take it up at another time.
Yeah, I agree. I agree.
Before we, yeah, Peggy and then Sarah one more time.
Yeah, I think we should vote on Russell's resolution as to whether or not we want it. So I'd like to second his resolution.
Okay, great.
Well,
Sarah?
So I would just say that one example or of why this would be of import is that in Erie County and Nassau County, law enforcement have been deputized as contact tracers. So if your municipality, such as New York City, has a gang database, for example, and you are someone who's in that database, and the law enforcement officer in Erie County or in Nassau County look you up in that database before they call you, and then they ask you for contact information of the people you've associated with, then suddenly that information holds a very different value. And so I just want to echo what Carrie mentioned about the import of this kind of information. And we're privileged that it doesn't feel like it jeopardizes us, and that I can name my contacts and give their phone numbers without fear that that someone will be knocking down their doors for a reason other than contact tracing. And so just wanted to just raise the issue that this is a very real fear, even though it may not be something that that's in that is a immediate problem for many of us on this call.
But Sarah, correct me if I'm wrong, but didn't I read that the city council, I think, I'm not sure which body it was, but I read about this issue and I understand what you're saying, but haven't they guaranteed or instructed that like police and authorities of, you know, that people in law enforcement are not allowed to be contact tracers?
That's in the assembly bill as well, directly stated. I think this, just to refocus what exactly we're talking about for this resolution, it's, from my understanding, the part that seems to have sparked this larger debate was just simply calling or asking for a security expert to ensure that the database that they're using currently is protected. It's not about anything that has to do any of the information that exists within the database. It's just taking that extra level to ensure that the purpose of, you know, the bill doesn't have any loose ends.
I see. Sorry to have taken us off that point. But
No.
And I would support the data security provision.
Yeah. And just to address, I think one of the concerns raised earlier is that's, again, why we wanted to separate it. We didn't want there to be any doubt that we're in full support of the bill as it currently is. I see Peggy, I think, still has her. Oh, yeah, I see Russell.
I'd like to call the question.
Okay. Do you have a second?
I just, my one thought before we do that is, do we want to separate, if there's two issues in the second bill, do we want to just separate those into two separate resolutions? Does that make it easier? We can just vote on both. I mean,
I would. second that. And it's your resolution, so I don't even think you need.
Okay, so that's yeah.
Yeah.
I'm going to propose to separate them. I don't want to put people in a position where they, or like if they support the federal portion of it and want to vote against the data privacy, that's fine. And so let's just separate them.
Okay, that's good.
So I think Peggy called to questions, so we just need a second for the data. Let's start with the data security.
Second.
Yeah.
Oh, sorry.
Alita might be a second.
She said
Okay,
nothing.
Sarah, I see it. Sarah's the second. Okay, great. So let's take a vote. If this is again on the just calling for an expert to come and evaluate the system. If you would like to vote no, abstain, not vote for cause, please raise your hand.
Wait, I'll raise it. Wait, I'll raise it.
Not your real hand, the virtual.
I know. I'm sorry. I'm looking for it. Hold on. Yeah, it's reactions, right? Reactions? No.
No. The blue hand and the participants.
There you go.
Are. So that Alita's hand still raised. So let's call her first.
Alita, you're not unmuted.
Or did you?
She lowered her hand.
Sorry, I mute myself on my phone. I'm sorry for the confusion. I am abstaining because I'm not sure that asking for a data privacy expert to evaluate would slow down the whole bill and the privacy. And there are so many different questions about who would the data expert be, who would appoint them, who would evaluate them, that I think it would do. Perhaps I understand the purpose, and I know I shouldn't be giving this explanation, but maybe more delays than good. So I'd just be quiet now.
Okay, Lori?
I'm going to abstain also.
Okay, cause.
Yeah, I'm going to vote no on this. I think we're jumping the gun.
Cause,
Sorry.
no. And I still think it passed with the majority. Let me just count quickly. 1, 2, 3, 2.
Also Wilma. Wilma?
Oh, Wilma?
No.
Thank you, Wilma.
Oh, no.
What are you voting, Will?
I don't vote.
All right, I'm just gonna quickly count this. 1, 2. So 7 yeses, so it passes. Okay. Next,
Do you have to call the question on another one?
Yeah.
Okay, so I call the question on the federal one.
Do you have a second?
Second.
Okay, Lori, great. So if you want to vote no, abstain, or not vote for cause, please raise your hand. Brian?
I'm sorry, can we just clarify the question?
Oh, yeah.
Yeah.
I know, Russell, this is part of your resolution if you want to just restate.
Sure. So yeah, so we call on Congress to pass similar confidentiality protections with respect to contact tracing as are included in the Assembly bill, both to protect information collected at the federal level and also to ensure the protection of the information collected by state and local authorities.
So in other words, hands off.
Yeah, that's the idea.
Putting it politely.
Yes.
Does that clarify? Okay. Raise your hand if you want to vote no, abstain, or not vote for cause. Okay. Seeing none, that passed unanimously.
Good.
Before we do old business and new business, I just want to thank you, Carrie, so much for staying on with us the whole time and helping us answer questions.
My pleasure.
as we
Yeah,
internally
thanks again for
debated.
No, it was a good insight into the process. So best of luck and thanks again.
Thank you.
Thank you.
Sorry to backtrack a little bit. May just chatted me that she was abstaining and she couldn't get her audio to work. May, will you chat me which one of those two you're abstaining from? I assume from the first one that folks were. First one, yes, thank you.
So you mean the second resolution, the data security part?
Yes.
Okay.
Correct me if I'm wrong, May, in the chat. That's
fine.
Okay.
Oh, the very first one, federal level? No, that was the second one.
Second
right?
one.
No, federal is the third.
Federal's 3.
The federal was 2.2.
Yeah. Wait.
Okay, 2.2.
Yes. May, you've heard their explanation, so just tell me which one, and I'll make sure that Rebecca knows.
Yeah.
She'll get back to me.
It's either the data one or the federal one. I mean, those are the.
Yeah.
I think it's easier to think of it that way than numbering it because we're using different number systems.
Say hello to your wife for me.
The federal one.
I just saw her walk.
While we're clarifying that, I don't think HSS has any old business cause. Russell, do you have?
No, this is our first meeting in a long time, so we don't have any business.
Not yet.
Exactly.
Okay. And does anyone have any new business?
So which one of us is positive?
In what respect?
You know, if I'm going to get a phone call, I need to know.
Yeah.
Okay, so I think we're just waiting for May's answer, and then
Federal.
I think.
I said it.
Oh,
it's
federal.
federal.
Okay. Okay. Perfect. Does anyone have a motion to adjourn?
Yep.
Second.
Okay. Sorry.
Third.
Okay.
Thank
Great.
you.
Thanks. This was
right.
Very interesting. So thank you everyone so much.
Thanks. Thanks for leading, Rebecca.
Yeah, no, I mean, it was kind of all of us, but great.
All right. Take care.